Next, let's talk a little bit about study designs. Different study designs have different abilities to determine cause and effect between the IV or exposure and DV or outcome. So a systematic review or meta-analysis is at the top of this ability to determine cause and effect, working our way down to ideas, opinions, animal research, and laboratory test research. Most of what you'll see in public health is somewhere between a systematic review meta-analysis and case reports. We don't usually go much below there. So what we'll identify is systematic reviews, randomized controlled trials, cohort studies, case control studies, cross-sectional studies, case series, and case reports. Some types of epidemiological studies are observational. This is when one or more groups are observed and the characteristics are recorded for analysis. There's 4 types of these studies, including case series, cross-sectional, case control, and cohort. Some experimental studies are investigator-controlled studies applied to humans or animals under controlled conditions to assess intervention efficacy. So this would be a randomized controlled trial, which is the gold standard of trials, or a randomized group trial. A case series report is a simple descriptive account of characteristics in a group of patients. So one case would be one person who has that disease of interest. And then we use chart notes from several of those cases to write a journal article. Some strength is used for a lot of new emerging diseases or epidemics and to generate hypotheses for future study. Some weaknesses, it's least valid approach for causation, and it's the least control of competing variables. Cross-sectional study is observing participants at a fixed time period and the factors present or absent at that time and diseases are investigated. So both your risk factors and the disease that you're looking at are measured at the same point in time. Since they're measured at the same point in time, we have no evidence of temporality because we're measuring them at the same time. So we don't know if those risk factors caused the disease or if the disease came first and those risk factors showed up later. This is often used to generate hypotheses, and it can be completed quickly and inexpensively. So this is a lot of times what's done because it is quicker and more inexpensive. And this would be surveys, would be the way this is collected information-wise. The measure of association used is the odds ratio. So in a cross-sectional study, odds ratio is used, but a lot of times we're also summarizing things in terms of descriptives and trying to predict what caused what or what's related to different diseases. A case control study is an observational study where the sample is taken first based on the presence or outcome of the disease or other outcome we're interested in, so those cases. Then we match those cases to controls, people without that disease, based on similar demographics to our cases to minimize confounding bias. And then we collect information about earlier exposures to other risk factors we're interested in based on whatever that disease might be. The strengths of this are it's good for rare diseases, can study multiple exposures for a single disease, and it's very inexpensive and not time consuming as much as some others may be. Some weaknesses: it's inefficient for studying diseases with rare exposures. Assessment of prior exposures may be difficult. People might not remember. And you can't compute incidence rate, but you can do an odds ratio, is its measure of association. A cohort study is an observational study where a sample of participants are based on the presence or absence of a risk factor. And we're looking to see that no one has that disease or outcome we're interested in at the beginning of the study. And then all of the participants are followed over a period of time to see if they develop that disease or other outcome we're interested in. This is the measure for this is called the relative risk. The randomized controlled trial is a comparative study where there's two groups. There's one overall group of people that are randomized into two groups, a treatment group and a control group. Both groups are then followed, and then over time we compare their results to those who received the treatment versus those who didn't. There are also crossover designs where groups of patients receive all the treatment and control conditions but in different sequences. So this is done a lot to see if there's differing outcomes based on how the treatment or the medicine is dosed. And at the end, we have the meta-analyses or systematic reviews. So this is when there's a statistical analysis that combines results from multiple randomized controlled trials or other studies in order to drive overall conclusions. So a number of different studies are combined into one journal article. You can find these on the Cochrane database of systematic reviews, the Guide to Clinical Preventative Services, Cochrane Public Health Topic Reviews, and the Guide to Preventative Services Community Guide. These are really great when you're studying a topic or disease you don't know much about, because it gives you a lot of information, but you're only reading one article instead of all 15 of those articles that it talks about. So these are a great time saver when you're doing a literature review, because you can then talk about what's been done in a number of different places, but you only have to look at one article instead of all 12.